Fury FC 76 featured one of the most concerning officiating jobs I've certainly seen in the mixed martial arts world, and also one of the most dangerous, as one of the fighters was seemingly put to sleep well before the fight was actually stopped. It was allowed to continue, with likely further damage being done on a fighter who seemed like he was already out. Welcome back, everybody. I'm Dr. Brian Sutterer, and on this channel, my goal is to teach you about the underlying anatomy and mechanisms of various sports medicine topics. So if that kind of thing interests you, please consider subscribing to help support the channel. Let's walk through the sequence here and talk about what we're seeing and some of the mechanisms and anatomy. Let's just walk through the sequence here and talk about what's going on. The fighter in the blue gloves here is being put into an arm triangle, right? This is a submission move that's attempting to either cause a fighter to tap out because of the pain and the fear of going unconscious, or to ultimately completely submit them and put them to sleep. If you generalize submission types in terms of when somebody might go unconscious, there's an air choke and a blood choke, because those are the two things that are going to influence the consciousness of the competitor. We'll look at the anatomy in a bit, but simply put, the air choke is trying to constrict or close off the trachea, which is delivering air and oxygen to the lungs and then subsequently to the brain. And a blood choke is trying to affect the blood supply to the brain, ultimately again with the goal of causing that loss of consciousness. Let's continue the clip. At this point, we're at about 3 minutes, 28 seconds in the round, and to me, it looks already like Vasquez is potentially asleep here. He's already been in this choke, he's rolled over, we don't really see any clear attempts to fight, it looks like his eyes are closed, and so I would already in that moment be moving his hand. I'd be trying to shake him in some way to see if he was asleep, because it doesn't matter how long you're asleep or if you can come back. As soon as you're put to sleep, it should be immediately stopped. He's doing some unusual kind of breathing that even the announcers commented on. As we flip over, we don't see his face, but again, we've already seen he looks like his eyes are closed. He doesn't appear to be fighting back. Again, at this point, you absolutely have to go and shake the fighter's hand, look and see if they're unresponsive. Do something physical other than just looking, because loss of consciousness, syncope, can be very confusing sometimes, where people will actually have abnormal seizure-like movements, things called like myoclonic jerks, as they lose consciousness, where sometimes it might look like something's happening or they're having a seizure. And so in a case like this, some of these movements, some of these sort of twitches could potentially just be these myoclonic jerks, and you really have to physically check and see if somebody's unconscious with a more sort of active intervention. If we then keep going here, we can see ultimately he does these sort of violent leg kicks. It looks like the pressure is released a little bit on the neck, so thankfully we're getting some blood flow back. We're now at about 3:15 in the fight. But then there's risk for further damage here, because it still looks like Vasquez isn't exactly fully responding here. He doesn't seem to be fighting this submission armbar attempt at all. And if we look at the position of his right shoulder, look how severely forward or elevated anterior his right shoulder is relative to his chest. This is very concerning for, at minimum, a shoulder dislocation. Here in this clip, you can see a little bit of the outline of likely his humeral head, so the ball of the arm bone. The idea with an armbar like this is that you're trying to lever the front of the arm, the anterior part of the humerus, forward, because that's the way that the shoulder tends to typically dislocate. And in this sequence, it looks like that shoulder is just kind of freely moving around with no real resistance from Vasquez. Now, I will say, if all we had seen in the fight was this sequence with the armbar, I'd give the referee the benefit of the doubt more, because this isn't a chokehold attempt. You're not trying to make the person go unconscious. You're trying to just cause pain and ultimately injury if they don't tap. So if this was all we had seen, I'd say, okay, let it continue. So he's not fighting back. Maybe he's just trying to wait out and get out of this. But it's because of everything we saw beforehand with the choke, where it looked like there was some loss of consciousness, that makes this more concerning. Because when you lose consciousness, it's not just the risk of further blood constriction to the brain that can ultimately be fatal, but it's how you can have subsequent injuries to your body because you're not awake and you're not able to actively protect yourself. The only real update I've seen from last night is that Vasquez, the fighter who was in that submission hold, was taken to the ER, but couldn't really move his right arm very well. He hadn't been seen by a doctor yet, but they were concerned about at least a severe arm or shoulder dislocation. So let's talk about some of this on the anatomy model. The first thing to discuss are these different chokeholds. And there's a couple different reasons why somebody ultimately would go unconscious with an arm or triangle choke like this. If we look deeper in the neck, of course, superficially, you're going to have the external jugular vein. That's what you can actually see just under the surface of your skin. Compression of this is not going to do anything to affect your consciousness. Deeper to that, within the carotid triangle, we have the internal or the deeper jugular vein, and then the common carotid artery. The common carotid artery travels up on both sides. So we have one on the left, one on the right, and then it branches off into the internal, which goes up into the brain to supply blood directly to the brain, and the external carotid artery that's going to go on and supply more blood to kind of the area around the face and the head. There's also a very important structure that's located at this bifurcation of the carotid arteries called the carotid sinus or the carotid body. This is an area of cells within the blood vessel that's responsible for regulating blood pressure. Basically, if you have increased pressure sensed at this sort of carotid body or carotid sinus, that tells your brain that the blood pressure in the rest of the body is high and that it needs to adjust accordingly to decrease the blood pressure. It does that by dilating the blood vessels to decrease the pressure, and then it's also going to affect the heart rate. Some people have such severe sensitivity of that carotid sinus that even just shaving their neck or wearing a tight dress shirt can cause alterations in blood pressure that can ultimately make somebody lose consciousness and pass out. So with a triangle like this, there's in part some compression from the arm being up. That soft tissue from the shoulder is going to compress and push against the neck. It's going to cause some irritation of that carotid body and carotid sinus, and if the pressure were significant enough, some occlusion of that carotid artery. Then on the other side, of course, you have the actual arm, and so you're kind of compressing things from the both side. You're affecting both that carotid body, and you're also affecting sometimes just the occlusion or the flow of the carotid blood vessel. With an air choke, you're essentially trying to occlude the trachea, which is the windpipe that sits in front of the neck. This is something that usually is a lot more painful, and people are going to tap before you're actually crushing the trachea, but can be equally concerning because if you don't, the trachea is sort of this connective tissue, cartilage-like structure that can actually break and can be injured and can swell up enough to where you get complete occlusion of the pathway where air is going to get down to the body, and that can be just as severe and potentially fatal of an injury. So both of these are very serious, but different mechanisms through which you're trying to cause a submission attempt. A blood choke or a triangle like this or a rear naked choke can certainly be fatal. If the occlusion is held long enough and there's no blood flow coming from the carotids to get up to the brain, usually in the order of maybe as little as 20 to 30 seconds, these things can have severe life-altering consequences and become fatal. So it's really important that the pressure is released and that this choke doesn't continue indefinitely because, of course, it can be a serious thing. Talking a little bit about the shoulder and why he potentially couldn't move his arm, if we look at just this little sequence here as that arm bar is being started, you can kind of see how the shoulder almost shifts up. It kind of just floats forward up off of his body. And to me, this is concerning because it doesn't really look like he's fighting back or trying to actively prevent that shoulder from moving forward with activation of other muscles. But in this position, of course, we've got the head of the humerus that's coming out here. And as the humerus kind of goes past the socket of the shoulder, you can tear the labrum. You can also actually tear nerves whenever you dislocate your shoulder, one in particular called the radial nerve that kind of wraps down around the neck here of the humerus. Whenever that nerve gets stretched, you can cause weakness and damage throughout the arm. The other thing too that I always think about with some of these submissions, especially when somebody is maybe unconscious and not able to protect themselves, is you of course have the brachial plexus. The brachial plexus is this group of nerves that sits bunched together up in the neck after running out from the cervical spine. Any sort of direct compression, stretching mechanism, especially with decreased blood flow to those nerves, can cause more permanent injury or long-term injury to just this group of nerves called the brachial plexus, which is going to sit higher up in the neck. Officiating a mixed martial arts fight is a very, very hard thing because you're trying to toe the line between excessive and dangerous levels of damage and safety, but yet maintaining that competitive nature of the sport. I think at a minimum, there needs to be better instruction about officials going in and physically moving, physically touching one of the fighters when there's a submission attempt being tried to see if they're not responding at all. Because like I said, if these submission attempts are just held indefinitely, they can absolutely become fatal, which probably is not news to anybody. And remember, whenever you are unconscious, your muscles are not volitionally firing. Yes, you may have some myoclonic jerks, you may have some brief sort of seizure-like activity, but that's not volitional. That's not you firing your muscles to protect your body. And your muscles are there just as much to protect your joints, protect your soft tissues like your nerves, as they are to help you throw a punch or perform a submission. When you're unconscious, you don't have that ability to protect yourself, and so you're much more predisposed to damage from something like an arm bar, or if your neck gets cranked or twisted in a certain way. You can't protect yourself because you're unconscious, which makes the whole situation much more dangerous. I hope people keep talking about this because for the safety of these fighters, it's important that these conversations are had and that we look at situations like this, see what went wrong, learn from those mistakes, and make sure they never happen again because we want to keep our fighters safe and help the sport going forward. That's it for the video, everybody. Let me know as always any questions or comments down below, and until next time, we'll see you later. Bye.